Good evening. I'm Dr. Allan Perel, and this is Conversations in Medicine. This program brings cutting-edge medical topics to the Staten Island and the entire New York City tri-state area. It is my pleasure that we have two wonderful guests. We're going to talk about pediatrics, and I'll tell everyone a secret. Every physician in the world, every healthcare provider in the world, always wanted to be a pediatrician in medical school. When you do your 6-week rotation, or however long it is now, everybody falls in love with the kids, with taking care of them. And it's such a wonderful, wonderful profession that all doctors wanted to be a pediatrician at one time. Some of us, though, didn't have the wherewithals to get there. So I have two wonderful and absolutely amazing pediatricians. One of them is actually the pediatrician of my kids. So I'm going to introduce Dr. Anna Mendez. She's the director, or chief?
Chief of Ambulatory Pediatrics
at Richmond University Medical Center.
Good evening.
And Dr. Miroshnichenko.
Yep.
The chief. Everyone, we're a lot of chiefs, and I'm the chief of neurology, but the chief of developmental behavior in the Department of Pediatrics. And again, when you think about developmental behavior, we think about people with learning disabilities, autism, things like that, and it's become such a hot topic, such a prevalent issue that we talk about. But we're going to talk about today is general pediatrics. And when do you bring your kid to the pediatrician? Should you get vaccines? And I really have two experts here. We did a show on vaccines a few months ago about COVID vaccines because there was a lot of controversy. We're going to actually start out with vaccines because there's been a lot of things in the news about hepatitis B and getting vaccinated. And I have some experts here, and I really just want to put some science behind the rhetoric. So Anna, maybe tell us a little bit about vaccines and really the relationship that you have with the families and not just the child.
Thank you. So vaccines have been life-saving for kids since they come onto the scene at the beginning of the 20th century. This is what pediatricians do for children to avoid them from getting really sick, dying from some diseases they used to die from, and being disabled. So the mainstay of our work is to really do preventive medicine by vaccinating kids. And we do it according to their age and what they're at risk for at the age that we see them. And we start at birth with hepatitis B. And we do so because hepatitis B is a disease that can cause in adults liver cancer. And by vaccinating kids at birth, we can prevent passage of hepatitis B from the mother to the child. Even if the mother's negative, a test is not always perfect. And it has decreased greatly the prevalence of liver cancer from hepatitis B worldwide with hepatitis B vaccine.
So let me ask you the two parts of that. And as an adult doctor, as a neurologist, so the questions come up, and a lot of things have been in the news very recently, and the show's going to air over the next day or two. So the idea of whether you give this vaccine at day 1 at birth or wait 2 or 3 months, is that a big difference?
There is a big difference. So one of the things that in the news they have said is like, look and see if the mom is not hepatitis B positive, then you don't have to give it. Well, that's not true. We have to think that everything that we do in medicine cannot be 100% results. So a test can always have a false negative, right? So if we give the hepatitis B vaccine at birth, which is actually New York State law to give hepatitis vaccine at birth, that we have to offer it by law. And that's because we know it's life-saving for that person. It's not going to show immediately, but you can theoretically have a mother who tests negative for hepatitis B. You give the hepatitis B vaccine, the child can mount immune reaction and might be able to avoid getting hepatitis B infected and not develop hepatitis B cancer in the future. Now, that's why we do it at birth. And there is a big difference if you wait, if you're that one child who might have a mother who has a false negative test.
Okay, so the science basically, and again, from two pediatricians, the idea is really to do it at birth.
Absolutely. But if you don't do it at birth, you should do it next time, soon as possible. Because, hepatitis B still is infective in different ways throughout people's lives, and it's better late than never.
It's a bad disease.
It's a bad
Whether
disease.
for kids or an adult, it's
exactly.
a bad disease.
Hepatitis B, we don't see it. So that's why people don't think of it. But, but it can cause hepatitis that makes you sick for years, and it can give you liver cancer when you're an adult, and those are things we can prevent.
And I know New York State is still recommending strongly.
Absolutely. Actually, we have to offer it parents obviously have the right over their children to accept care. But the New York State does require that we offer it in the hospital at birth.
So let me go with some things that just look like logic, especially watching television and hearing things in the news. Putting multiple vaccines together. I understand the issue, like you think about things like MMR, all kinds of different initials that we put together, and we'll actually break it down a little bit. Why do we have to put it in the same one, and is there any more risk to that? And maybe, Dr. Miroshnichenko, if you can help me a little bit, because, and I'm going to let you go into part 2 of it.
Sure.
MMR has gotten a very
close attention.
There's a lot of close attention with regard to developmental delays and autism. Maybe we'll just even start. Why not just give the kid 3 shots? I mean, nobody really wanted to take shots in the beginning, but is there a reason that putting it all together, is the safety there? And either one of you
So maybe I can start and you can go over the MMR. So I always remind parents that there are thousands and thousands of antigens, meaning things that kids make antibodies to in our environment.
Those are like protein. Those are all proteins.
Every single day your child is alive is fighting something and making antibodies. The organisms that we give vaccines, they're superbugs. So no matter who you are, if you're not vaccinated against it, you're going to get pretty sick, you can get disabled, or you can die from it. So FDR got polio as an adult and couldn't walk, right? Because there was no polio vaccine, right? So you can get polio if you don't have a polio vaccine, right? So that's why we give it. Now, in terms of antigens, if your body can deal with thousands of antigens every day, they can absolutely deal with 3 antigens in one vaccine. And why do we do that? Because it's more comfortable for the child. It is very traumatic to bring a child 10 times to give one vaccine at a time, not to give them together, when it doesn't make a difference in the way your body reacts to it. Vaccines are very safe, it's not dangerous, and I always remind parents, your child and you are fighting thousands and thousands of antigens on a daily basis. 3 more antigens in a vaccine is not going to make a difference in how your body reacts, and it's not, it's safe.
So, I'm going to go into a little bit about the adjuvants. There's been a lot of talk about mercury and other things in there. Maybe if you could just talk about, and this is going to segue into developmental issues that really were in the news for a while. And I want you to be as scientific as you can, but also as definitive as you can in your expertise. So when they talk about adjuvant, maybe just if you could define that for us.
So adjuvants are additives to the vaccines, which are very important because the vaccine is a biological product. And any biological product is supposed to have some additives to it because we store vaccines for some time. And therefore, they have to be sterile, and they have to be viable, they have to be potent. So some adjuvants are helping antigens, as Anna mentioned, to make an impact into our immune system, to improve the chances for immune system to build a significant immunity. Okay, some adjuvants are there because we want the vaccine to last for a year, for example. Before the vaccine comes to specifically to pediatric patients, the vaccines are tested vigorously, FDA approved, and every single vaccine has an insert where all the components are listed. So before the FDA approval, the vaccine has to be safe. And adding the chemicals which are not safe, for example, mercury, is not acceptable. So when people talk about adjuvants and the connection to other diseases, specifically neurodevelopmental conditions, it simply goes against the science. And every parent can look up FDA approval for every single vaccine and see the rigorous research behind every single vaccine.
So definitively, you don't feel that any of the stuff they put in the vaccine is dangerous to the child?
Not in U.S. vaccines,
Right.
which are available in U.S. I cannot vouch for other countries,
Exactly.
right? Developing world, maybe it's different. But when we talk about vaccines which are used here in USA, the vaccines are very safe, especially the vaccines which are used in pediatrics. Even COVID vaccine, which had a shorter time clinical research-wise, is extremely safe, and recent variant of COVID vaccine was approved for children who are 6 months and older, which means that it's very safe. It doesn't mean that any biological product cannot cause the reaction. And we talk about allergic reaction to the vaccines. Yes, it's possible to get the reaction. When we have a conversation before the vaccination, we always emphasize the fact and ask about allergies, potential allergies. For example, flu vaccine, which some of the components of flu vaccine could be from cultured in the chicken embryo. Children who have allergy to eggs, we have to be careful considering the specific type of flu vaccine that we're going to use. And I also wanted to add something about hepatitis B vaccine, just to close the loop. From my perspective, there are two unique vaccines that exist in the world, basically, hepatitis B vaccine and HPV vaccine, which prevent cancer. There is no other vaccine which has these qualities. And I think it's very important when we talk to parents about it, to emphasize the fact that you are basically allowing your child to be cancer-free.
Cancer-free, yeah.
There are certain cancers that are developed because of the viruses.
Absolutely.
Exactly.
Both of them.
Yeah,
Absolutely.
hepatitis B virus and HPV virus.
So we're going to go back to the vaccines a little bit, but back to the timing. When MMR came out, and again, the dates that are given, the risk of, or the diagnosis of autism usually comes around that time, it's between 18 months, 2 years
Yes.
of age. Do you believe that based on the science and the multiple studies from around the world, you could see why parents would think that autism, there's a relationship. There's a temporal time relationship between getting this vaccine and many kids developing autistic symptoms, whether different words that we could use
Right.
for it, and the whole spectrum of this. In the old days, it used to be called PDD or all kinds of other things. But that just the timing of it seems a little bit odd. How do you make our audience has, and there are families out there who have autistic children,
Of course.
who are all over and very vocal and very wonderful, and the question comes to them: is it a coincidence or not? People try not to believe in coincidences. So, what does the science show, and really where do we go with that?
Yes, I agree with your statements 100%, and I feel very strongly that this is the concern for especially young parents, right, who expect their children to thrive, develop typically, and have the best life ever. So, based on the science that we have available now, there is no evidence which point to the vaccines as cause of autism or any neurodevelopmental conditions. So autism is a neurodevelopmental condition, chronic neurodevelopmental condition, which is multifactorial. Unfortunately, we don't know the cause. There are a lot of speculations, many theories. What we know is that genetic component, genetic predisposition is probably the most causative relationship to autism. So if we, for example, counsel the young family and they happen to have a child with autism, we have to counsel about potential risk for the other sibling to have the same condition. Maybe not the same severity, but the risk of autism is significantly
But there is
higher.
no direct genetic test.
No, there is none.
And I was hearing about this recently. There was a family that was going through in vitro fertilization, and the number of things that they could find in the genetics of the new fetus just by taking some cells and looking at them was just amazing to me.
Yeah.
It's changed so much. Asking, do they know almost what their hair color will be and what their eye color. It's very, very interesting. Of course, there's sex of the baby, but there's nothing that could be tested
No, unfortunately, we don't have a gene which is responsible, 100% responsible for autism. There are multiple gene candidates. There is about 130 gene candidates. There are associations with the syndromes. For example, Fragile X syndrome has a higher prevalence of autism as a comorbid condition. But there is no one gene which is responsible for autism.
So we talked about vaccines. Probably, at least with all the science out there, there's no evidence.
No.
That it's always harder to prove a negative sometimes, but there's really no evidence about it. Let's just go back to some of the vaccines. MMR. I mean, polio, we talked about it. We had presidents, we have senators, even present-day senators who had polio, who have difficulty with walking from it. And in my earlier training, even in my earlier part of my career, I've been doing neurology now for 25 years, and that I had patients who came in with polio, and people in the 1950s, early 60s.
The vaccine.
Right, that's when the vaccine came out, but there were people right beforehand who had polio, and you see very characteristic atrophic or thin limbs, and these are people who were respirators, and we call them iron lungs at that time, helped them live. So we talk about polio and how miraculous it is. But polio sometimes, yes, we don't remember it, and thank God we're still doing okay with it. MMR, we hear about measles all the time.
Yes.
And all I know about measles is if two people in the airport have measles, the whole airport has to worry about it.
Yes.
And so tell us something about that virus and what makes it so...
It's very contagious. It's highly contagious. So that's why, if you have one index case, everybody in the area should be worried. Measles also is a very severe disease, especially in the very young. We give it at 12 months of age because in our communities, we have a high herd immunity, right?
Which means what?
Which means that there has to be above 95, 93%, it's in that mid-high 90s, number of kids vaccinated in that community for that disease not to appear. So when people don't vaccinate their kids, they're not only putting their kid at risk, they're putting all the other kids at risk, especially with something like measles, which follows herd immunity. So I will put an example. In New York City, luckily, there's a high prevalence of immunization against measles. So I can wait until 12 months of age to vaccinate a child with measles. And I do it at 12 months of age because it has been proven to give you lifelong immunity to do it at 12 months and then at 4 years of age, or catch up any time after that, after 4. Now, every week, I have people who travel to a developing country where measles is high. So to those families, I cancel them. There's no herd immunity where you're going. So we are allowed to give the measles, the MMR, at 6 months and above. So any child who's traveling to a developing country that doesn't have herd immunity, I will recommend the parent to give the MMR, because the younger you get it, the more likely you are to get the severe
And you can't separate, there is no M.
No, it's MMR. It doesn't come separately. No. So in the United States. So I give the MMR to those kids who are traveling, are 6 months and older, even if they're not 1, knowing that I will have to repeat it at 1, because I don't want them to go get measles and end up with pneumonitis in the hospital that can kill them, with encephalitis that can kill them.
Brain issues.
So those things and we just had cases of kids who died in Texas in the last year because they came into the ICU with an infection of the lung, an infection in the brain, and they didn't do well and they were young kids.
A few years ago, in the news, it said that we've almost eradicated measles.
We had eradicated until now.
But interesting enough, the virus doesn't go away, does it?
No, it exists.
Same thing with smallpox.
Exactly.
It's still there, but we just have most of the people are immune to it, have this herd immunity.
Exactly.
So if everybody stopped taking it, they would get smallpox would come back. Measles would come back.
So actually, smallpox is a great example because smallpox, there was worldwide herd immunity, and there are very few places in the world where people can get smallpox nowadays. With measles, we almost eradicated in the 90s, right? And then when all this controversy came about, people started vaccinating their kids, and it's back in pockets. And now with what's going on, states that are not requiring people to get vaccinated, you're seeing what's happening there. I don't have to tell you. You see it in the news every day. So, we're lucky that we live in a city that has high herd immunity, but if we keep eroding at it, we are going to end up having kids in our own midst that can end up the way these kids ended up in Texas.
I think the smallpox story is so interesting, of course, how amazing it is that they were
And we don't have it anymore. And
But-
do you know when they started vaccinating?
Tell me.
During the Revolutionary War.
Some of those old wars,
Yeah,
right?
the native people here taught us how to vaccinate, how to inoculate soldiers, and we did. And that's why once they started being inoculated, they started to survive smallpox and did better.
And it was such a terrible disease.
It was.
And again, people don't know this. I didn't know this. Why do people have that mark when the
I do
older
have
people? They have that
You
mark
want to explain since you got it?
because they had to show. That's actually a scar. That
You
was-
have to show,
that-
and this is exactly
that-
what they did.
Right. That was not
The
because
same.
the vaccine caused it.
No.
It wasn't because the needle caused it, because we give vaccines all the
No.
time. It was to show that you were immune from this terrible disease.
So you can walk in, yeah, exactly.
Yes.
Exactly.
So it makes it very, very interesting.
Exactly.
So we have a few minutes left, but I want to go into really primary care pediatrics. It's the winter time. Everybody has the sniffles.
Yes, they do.
When do they call their pediatrician?
Well, nowadays it's hard because, you have COVID around. It's always scary to have a small child with COVID because the smaller they are, the worse they can do with COVID. So, I always ask, especially the younger they are, for them to, anytime there's a fever, to call us because COVID still is, even though kids tolerate it well, the younger the kid is, the more likely they can get into trouble. So I always encourage them to call. So I always tell parents, when you don't feel comfortable, call us. And if they're not vaccinated against the flu, please call us because we can treat the flu so they don't get to minimize the possible,
And what about RSV? That's
complications.
another.
Oh, RSV, we are vaccinating, we are giving monoclonal antibodies against RSV to all
Tell us
children.
what a monoclonal antibody is.
So you remember the monoclonal antibodies from COVID? Like you would get the antibodies and you wouldn't get it would prevent COVID at the beginning. But when we had the actual antibodies, and COVID changed and we couldn't make antibodies. It kept changing. But RSV doesn't change. So RSV, we know the monoclonal antibodies for the last probably 30 years. We only gave it to preemies, but we realized that most of the kids getting really sick in the ICU were full term. So now we offer it from birth until 7 months of age to every kid who comes to our office, and we are minimizing how many kids end up in the ICU.
And that's an intravenous therapy?
No, it's
No.
not. It's a shot.
Intramuscular shot.
Intramuscular.
shot.
But it's not a vaccine. It's a monoclonal antibody.
Passive immunity.
Passive immunity. It's different.
It's
And I always explain to parents, this is not a vaccine.
It's funny because now I actually remember why everybody didn't go into pediatrics, because there was always a night when we had to put an intravenous in a baby, and doing that was such a harrowing
Not
event
easy.
that only the very special doctors were able to actually do that part. So now I know why we all found out at the end didn't go into pediatrics. So tell me, what's up and coming in general pediatrics? So think about it. When a child gets older, they don't want to go to the pediatrician. So once you get to 6, 7, 8, they'll check in at 21 maybe or 30. So what's the value of seeing a pediatrician in those days?
So the value is that we do preventive medicine according to age, and certain things can pop up at different ages, right? In the early childhood is preventing infections, looking at development. The older child is looking at mental health.
Yes.
Mental health is huge, starting at the age of 5. We start in our own practice evaluating for mental health, how they're doing in school, which is their socialization, their self-esteem, and also checking that they are, some recommendations from the AAP in terms of checking their cholesterol at 9, seeing if their weight puts them at risk for metabolic abnormalities. These things have value. We check their vision, their hearing, and what we want to do is optimize their ability to become the best adult they can be. And going to the doctor once a year definitely is worth doing that.
Do you think the public schools, and maybe go to Ina because I know you do a lot of developmental work.
Sure.
The public schools seem to be testing the kids' hearing, vision. I see a lot of people in my practice with attention deficit hyperactivity disorder. And I'm somewhat shocked that they've gotten through the entire 12 years of public education.
Yeah.
I think some of the parochial private schools, sometimes they don't have the resources to do all the screening. But knowing about IEPs and developmental issues and assessments that they do in the school system, I don't see people being picked up for ADHD. And again, that's not directly, it might be part of what you're doing in a little bit of the older kids. Any thoughts about that, or general pediatricians, about how they get there? Because so many people think that they've got ADHD.
So I think the pediatrician is the key person in helping parents to realize that the symptoms are there. Because a lot of times when they come to you as adults, young adults, right, you hear the stories. Oh, my child was a little bit rowdy, a little hyperactive, didn't pay attention, but we didn't want to pursue the diagnosis. So it's not about the child. At times, we have the families where the child says, really, I think I cannot focus in school, right? And it could be even a 10-year-old who can make this statement. And then the parents may pay attention to it. And of course, they're going to talk to the pediatrician. So if there is a continuity, let's say the pediatrician, Dr. Mendez, knows the child, knows the family, knows the siblings, knows the family history. And it happened that on both sides of the family, there are people who were diagnosed with ADHD, or maybe not diagnosed, but were hyperactive and attentive, really struggling with executive function. That's going to help. That is going to help the family to reconsider, pay a little bit more attention to the symptoms. And unfortunately, we know that ADHD goes hand in hand with learning difficulty, for example, right? With anxiety, depression, other comorbid mental health conditions. So I think it's very important to run it by pediatrician, and that, as Dr. Mendez said, is another reason for the existence of this long-term relationship.
And that's so crucial, the long-term relationship. When does someone stop seeing their pediatrician?
21 when they turn 22.
So how many patients do you have over 21?
I have a good amount.
They do.
I have a good amount.
No, I'm saying,
yes.
I know, but you also do internal medicine.
Well, I did med
It's a little tricky.
I med peds, but my colleagues who are pediatricians in our practice also see them up to 21. And, you know,
what I'm saying is they don't, many of them don't stop at 21. Some are very rigid about that rule. Sometimes I've seen 25, 30-year-olds coming into my office from the pediatricians.
Because they feel comfortable with you because you know them all their lives. But definitely 21 is the age that the AP recommends.
I want to thank you guys. What a wonderful half hour.
Thank
really
you.
learned a lot about pediatrics. Really trying to be as definitive as we can with vaccines, with regard to developmental evaluations. I want to thank everyone who helps make this show possible. We've been doing this for more than 10 years. I actually forgot how long it's been. I want to thank David. I want to thank Sal. I want to thank Helene, who one day I want to actually have on the show. And we basically can interview and talk about how hard it is to put the show together. So thank you all. It's been an absolute pleasure, and happy holidays.